Hello friends, my name is Dr.Muskaan Chabhra and I'm working as consultant IVF at Birla Fertility and IVF, Lajpat Nagar in New Delhi. Let me welcome you today in this session about IUI. So what is IUI? IUI means intrauterine insemination. Intrauterine insemination is one of the most basic procedures which we do in fertility clinics and one of the most first line procedures which is done for patients who approach us for conception. So there are some prerequisites for IUI जो कि IUI plan करने से पहले देखा जाता है for a couple to understand if they are suitable to undergo an IUI. Because for cases of IUI it is very important to do good patient selection. अगर हम एक बेसिक फीमेल एनाटमी समझने की कोशिश करें वाया दिस मॉडल, देन दिस इज़ द ओवरी या फिर जिसे हम हिंदी में बोलते हैं अंडकोश, दिस इज़ द ट्यूब एंड दिस इज़ द यूट्रस, मतलब कि हमारी बच्चेदानी. सो यूजुअली क्या होता है, एट द स्टार्ट ऑफ द मेंस्ट्रुअल साइकिल एन एग विल ग्रो इनसाइड द ovary. And this egg will grow and become big in size, and by day 14 or 15 of your cycle, this egg will rupture. Once this egg ruptures, ये egg pick up होता है by this fallopian tube. Fallopian tube has small micro movements with the help of which this egg will go and travel through this tube. Also tube के अंदर जब egg होता है तो any semen which is traveling through the female genital tract at that time, the sperms will travel through the female genital tract and they will meet the egg inside this tube and they will form a baby which we call as the embryo. This embryo will then go and stick inside this uterus. This is what happens normally while we are trying to conceive. So, when we are trying to conceive, it is important to understand that an egg should form in our ovary. The tubes should be able to pick that egg up and that tube has to be open, and the uterus should be healthy so that the pregnancy can grow inside the uterus. What do we do before we plan an IUI for a patient? The first thing that we do is that we do all your baseline investigations, your hormonal tests and your blood tests. This will involve seeing your AMH, your thyroid levels, your prolactin levels, your general health, your vitamin D levels to see कि whether you are ovulating normally or not and whether the hormones which are regulating your ovulation are working properly or not. Second thing, we will do a basic ultrasound to see whether structurally the reproductive system is okay. On an ultrasound, we will be able to see the uterus. So we will be able to see your ovaries and your uterus. Ovaries में हम एक antral follicle count या फिर आपके baseline eggs का जो status है वो समझ में आएगा. और यूट्रस को जब हम देखेंगे वो हम ये समझ में आएगा कि उसमें कोई पॉलिप, कोई फाइब्रॉइड या फिर और कोई स्ट्रक्चरल प्रॉब्लम तो नहीं है. बिकॉज ऑल ऑफ दीज थिंग्स, इफ यू हैव अ लो रिजर्व और यू हैव अ फाइब्रॉइड और अ पॉलिप, दिस विल डिक्रीज योर चांसेस ऑफ कंसीविंग इन अ IUI. Also, we will do a basic semen analysis for your husband. Husband का semen analysis में count, volume of the sample, motility of the sperm and morphology या फिर sperm की बनावट, ये सब देखा जाता है. Because IUI में हमारा पर्पस ये है कि हम हस्बैंड के स्पर्म को वॉश करके उसको कॉन्सेंट्रेट करके आपके यूट्रस में डालें. इसके लिए ज़रूरी है कि एटलीस्ट स्पर्म के अंदर 5 to 10 मिलियन काउंट और अच्छी मोटिलिटी हो, तभी IUI के चांसेस हैं कि वो सक्सेसफुल होगा. Another important aspects of doing IUI is to understand whether your tubes are open or not. Because जो egg हमारी ovary में बनेगा, that has to be carried via your tubes and then fertilized in the tube to give a pregnancy. So basic prerequisite for any IUI is to know whether tubes are patent or not. ट्यूबल पेटेंसी के मल्टीपल टेस्ट होते हैं जिनमें से कोई भी टेस्ट किया जा सकता है टू अंडरस्टैंड कि हमारी ट्यूब्स ओपन हैं या नहीं हैं. इसमें से मोस्ट कॉमन टेस्ट इज द HSG टेस्ट which is the hysterosalpingogram, or the SIS test which is done with the help of an ultrasound, or a laparoscopy which is the gold standard test to understand कि हमारी ट्यूब्स ओपन है या नहीं है. अगर हमें IUI कराना है तो we will get best results only if our tubes are open and the status of the tubes should be known before we do an IUI. If you have any doubts or any queries, you can comment in the comment box below, or you can reach out to us at Birla Fertility and IVF. Thank you so much.
Book a free consultation today.